Okay, here we are for the next remove success story. And this time we are speaking to Paul Jackson. So Paul Jackson is currently in the remove program associated with prostate cancer research. And what we're going to be doing today is just be talking about, how he came to being diagnosed with prostate cancer, why he decided to join the remove program, what he's gained from it, and just his general journey with that so far as well. But as always, if you are watching this, again, because we've got a good story to share, please, if you are watching this, please just let us know that you're watching. Let us know in the comments. And also, if you've got any questions that you'd like to ask myself or Paul, as he's here now, please just write them in the comments and we will do our best to answer those. So, Paul, before we get into all the nitty gritty, can you just introduce yourself, like who you are, where you're from, and just something interesting about your backstory?
Oh, interesting. We'll work on that one.
We'll work on that bit.
So, for everybody watching, my name's Paul Jackson. I'm 59 years old. I currently live in Brighton. Spent most of my life living and working overseas. And what was the rest of the question? Something interesting.
That is pretty interesting. Working overseas, I think that's that's good.
And I suppose the interesting part is that I'm here today to represent the darker side of this disease.
Yeah, for those of you who've been tuning in to previous videos, previous conversations, we've had men who have been on active surveillance from prostate cancer. Also, we've had a guy that's had his prostate removed. And also we've had someone who's had radiotherapy and he's come out the back end of that. Whereas yours is a little bit different, isn't it?
Yeah. Quite a lot different.
Yeah. So Paul, like if you could just share, when were you diagnosed initially? Like how did you come about with being diagnosed with prostate cancer?
Well, I suppose that's an interesting part of the story, and probably it's not going to be unfamiliar to quite a lot of the people watching in this regard. I was completely non-symptomatic. I was not somebody that was getting up at night to have a wee. I wasn't somebody that was having some of the, any of the more classical symptoms. I didn't struggle to have a wee. I didn't have a weak bladder. Actually, nothing. And until the middle of January of this year, I would have considered myself fit, healthy, and nothing to give me any cause for concern whatsoever. And then, middle of January, I developed pain in the testicles and in the right-hand side of the groin, which are not necessarily classic symptoms or the way that medical professionals think about it. And I suspect, like so many people, I suffered with access to GP services in terms of the fact that I hadn't seen a GP in 20 or 30 years. When I moved back to Brighton from overseas a few years ago, 6 years ago, 7 years ago, I registered with a doctor here. They had never seen me. What I found interesting was going into I knew that something wasn't right. So I went in. And I think what surprised me was I was 58 at the time, when you have a 58-year-old man coming in and complaining about these sorts of symptoms, despite being on the books for a number of years. This is January, I was still being offered GP appointments in March. That was the degree of urgency with which it was considered. As the story goes on, I'm quite sure people were sitting there going, why didn't you go to A&E? And I think I probably come from sort of a background or, whatever. A&E is somewhere you go if you have an emergency.
Yeah,
If you
like
broke, if you've
broken a
broken
bone,
something,
or
you've
that's
had a
it.
heart attack, you've had is A&E really set up for somebody to walk in there and go, I have a pain in my groin? And you're trying to pursue the correct service anyway. So by the end of January, I was up to something like 3,000 milligrams of ibuprofen a day, just to try and
Take the edge off.
yeah. And as we discussed in the earlier sessions, it wasn't pain management. It was literally, as you say, just taking
Take the edge off. That's it.
yeah. I ended up with an emergency appointment, not even at my own surgery, where it was considered most likely to be a urinary tract infection or, incredibly, looking at the state of me, a sexually transmitted disease. That was what's going to cause interesting conversations there. No discussion about DRE, no thought or consideration about a PSA test. Nothing. Antibiotics.
To treat that
Yeah.
symptom, right? Now at the time, like where you said you had no symptoms, or no of the specific symptoms associated, so you weren't having any problems going to the toilet.
Yeah, let's call it the mythology.
Yeah.
The barroom understanding between men of what a dodgy prostate,
Yeah,
or how that manifests itself.
Yeah. So then, so that was in January. So when were you actually given the diagnosis that it was actually prostate cancer?
Oh, that takes a while. There was a follow-up appointment booked from the antibiotics to check if it worked. So we're now in the middle of February. So I went back for that one, and what they did at this stage was actually a urine sample and a dip test, and that showed that there was microblood in the urine. So they referred me for an ultrasound. At this stage, I had all the classic symptoms of sciatica to add as well in my right leg, so extremely painful. I was immobile and in pain, and that on top. And of course, it then turns out, then transpires it wasn't sciatica at all. The ultrasound comes back clear. I have a prostate that is completely normal for a man of my age. My bladder showed up clear, despite the fact there was blood. And quite incredibly, at that stage, there was sort of a no action. I got referred back to my own GP. So,
what was going through your head at this point, though?
Help.
As in help, as in what for? Like, as in like, just help me with the diagnosis, or help me with what's going on?
No, just help. I mean, anybody that's had sciatic pain will know that that's actually really quite added to the fact that I was on huge amounts of ibuprofen, being the only pain relief that was essentially being offered to me. That was a pretty miserable time. And was not particularly proud of it. I did end up going into my surgery and nearly got myself arrested for very threatening behaviour over the fact of you need to be taking this one seriously. And what happened at this juncture is I had a blood episode. Basically urinated, and it was black and brown. It was not, it was not pretty and viscous, and I really had to put my foot down, and I got an emergency appointment with a newly qualified locum doctor that was in the practice, who, fortunately, I suppose we could look at it, said, I'm actually not qualified to. So what I'm going to do is refer you.
In some ways, that's been a blessing.
Well, yeah, that turned out being a blessing.
Yeah.
19th of March, I went to, I met with Mr. Coker, my urological consultant, great consultant. And within 20 minutes, I was actually on hormone injections. And he basically told me, even without inspection, without biopsies, without anything else, that I had prostate cancer. 19th of March. But it then takes until the 8th of August before I get formal diagnosis.
It's another 4 months later.
Yeah, in between, in which time, and I've referred to it in our sessions before, that you essentially find yourself like an Uber driver to your own body. You're not in control of anything. You're not in control of the process.
No.
It's just a bombardment of appointments. Turn up here, turn up there, have that test done, have that test done. There are X-rays, MRIs, CTs. In this period as well, I had a cystoscopy, and that established that there were 2 tumours in the bladder. That sort of impeded, I suppose, on the formal diagnosis, on the basis of was it bladder cancer, was it? And it turned out. So I had a rigid cystoscopy procedure to remove those, which was very successful. And it turns out that they were prostate cancer. So despite having had an all clear from an ultrasound, which missed everything in the bladder and in the prostate, what had happened is that the prostate had burst, essentially out the top into the bladder in the first instance. By the time I get to August the 8th, I suppose what's difficult is that they are building their information.
Sorry, Paul, I think, have you got your hand over the microphone? I'm finding it a little bit tricky to hear you at the minute.
No, I hadn't, sorry. But
okay, that's right. Yeah, I can hear you now. Hear you.
The medical professionals are building their information. So it's not particularly a two-way street. So you have a lot of anxiety building through. So whilst there was every expectation, and I'd managed to get into my head prostate cancer, I suppose, like so many people, and certainly the people around me and my friends, were going, okay, it's prostate cancer. That's something you can live with. That's something that they can treat. And for the majority of people, that is most certainly the case. So, face-to-face meeting with the consultant on the 8th of August, and I am told that it's a very aggressive form of prostate cancer that has already spread through the lymph nodes and the bones. At which stage you're not talking about something that's easily treatable. What you're talking about now is something that's incurable, and that for anybody is quite a shock. Quite a shock to the system. And
How did that? You know, like when that was said to you that this is incurable. Like, how did you respond to that? How did you react to that in that moment? Can you remember, Paul?
Yeah, I mean, first I asked the consultant for a timeout. Suggested that he took his next patient and then came and got me from the coffee shop in the cancer centre, so that actually we could have a constructive conversation. It would take somebody pretty special when they get hit with that to be able to focus on a conversation.
Yeah, right.
Because your brain's going all over the place. You know, most people, and certainly me, the brain stopped at incurable.
Yeah.
What's that mean?
Well, we've spoken about this before, haven't we?
Yeah, and the difference between terminal and incurable.
Yeah.
You know, so, but it's still a lot to.
Of course.
Still a lot to digest, and even not on a particularly selfish basis, on a selfless basis, your brain is going, how do I tell my partner? Do I tell my partner? How do we deal with this? What does it mean for this? What does it mean for that? Work, social life, all these sorts of things.
So up, you know, like at this point now, you know, of the timeline.
Yeah.
How was your life impacted by what was going on? Like, were you still able to work? How was, you know, your social life? How was, you know, how are you just in general?
No, I mean, literally the wheels had fallen off everything. You know, so work and social life. Well, social life, you don't feel like socializing. Not if you're in pain, you know. So that had sort of slipped off the radar a bit. You know, you would try and do the occasional thing and sort of grimace, and you know, people go, "Well, how are you?" And you go, "Yeah, I'm absolutely fine." You know, whilst you're chinning the alcohol.
That's not like you.
No, it's not like me. But thinking the alcohol will take the edge off. You know, help me get through the evening. Yeah, there is no question that the disease, you know, from very early doors in my case, makes a liar out of you. You know, that's quite nasty. You know, so you don't want your loved ones to worry about you. You internalize a lot of stuff. That's not healthy. And we'll come on to the reasons why joining Remove and what have you. Of course, the timing of me joining Remove cut into and coincided with quite a lot of my journey. So you guys actually, you know, been on that path with me.
Yeah. So let's go on to that then. So first of all, how did you find out about the Remove program, Paul?
Probably like most of us. Which is of course, as soon as you get a whiff of this or of a diagnosis of this, you become a Google professor. You know, you think you know, but you're still going to Google it. You know, you're still going to research. You're going to still try and, you know, you don't know what it is that you want to understand, but you're going to go out there and look for it. You know, so what I would say to anybody watching this, or, you know, on this journey, if you are going to look it up, and you are going to look it up, stick to the NHS, Macmillan, Prostate Cancer Research UK, Cancer Research UK. Don't go down the rabbit hole of the American websites and statistics, because you're not going to get 3 heads. Your leg isn't going to fall off, and you're not going to die by tea time. You know, the American system is health system is different. Most of the clinics, you know, are private businesses. They have a completely different imperative as well. You know, so you know, it's really important to stick to good, trusted sources. And I'm sure a lot of the people watching this, like myself, the Macmillans are superb. If you need somebody to talk to within a sphere that understands this, they are superb. And I did have the benefit. So first off, I was referred to urology, and embedded within the urological team down here, we have Macmillan nurses. And they straddle between urology and oncology. And they are literally like your PAs. If you've got questions, they will find the answers. They will chase the bookings. They will chase the appointments. If you're having difficulty accessing anything, meds or anything, they will chase for you. They have been absolutely superb. But I would say to anybody, and it's understandable, wanting to research this disease, you know, that we have good, solid sources, reliable sources in the UK that you stick to.
That's it. So you was obviously doing your research, and then you came across the Remove program.
Yeah, I think 2 ways. I think one from the post that you were doing, and one from posts that Prostate Cancer Research were doing.
So what was your thoughts when you first saw it? When you first saw the information about the Remove program, what was your initial thought about it? Because just remember, like we've said, you know, that your type of prostate cancer is completely different to those with.
Yeah, but I didn't know that. I didn't know that when I was seeing this. You know, what I knew was that what I knew was that I was going to have a bit of a battle. You know, at this stage, I'd just been told.
Yeah.
That, you know, I had. You know, at this stage, you know, I'm not au fait with Gleason scores. I'm not, it's not crossed my radar before to think about staging of cancers, or you know, how aggressive they are, or what damage may have been done. I'm still in the mindset that, you know, prostate can be bad, and never to underestimate the disease, but that it's probably, you know, that it's manageable, but that I'm going to need help with that management. Not because I was particularly unfit or anything else, but because, you know, having gone through months of pain, motivation is slightly down the agenda. Yeah, it's weird, isn't it? So it started off as I was inquisitive. I wasn't sure what structure you would take. I wasn't particularly keen on, you know, some form of well, the 2 extremes, I suppose, that, you know, the overly happy clapper motivational type. You're all wonderful, you're all good, or the other extreme of the boot camp of, I don't care if your leg has fallen off, you will get out and do 7,000 steps. But I knew I would need help, and there had to be. just common sense applying. You have to inquire for the one that has been set up to deal with prostate cancer. There's no point me going down to my local gym, and asking for a fitness routine. No, because it's not going to take into account how I'm feeling, what I'm feeling, what my limitations are. And we've discussed this, and we covered this in the group talks. I went from in a year, I've gone from a position, or I had gone from a position of being able to leg press 2.5 times my own body weight to not being able to do the stairs.
That in itself is up here as well, isn't it?
Oh yeah. And then you find you've lost nearly 2 inches in height through spinal cord compression. That you've got to be careful. You've got to be careful even about how you carry your bag of shopping, because of the damage it's done to the bones. But of course, at this stage, I didn't know it when I took the program. So we're back to I was going to need motivating, and I was going to need help being motivated. So I made the application, and then it was quiet for a while, and then Lizzie comes back and goes, "Congratulations,
let's do it.
You've been picked for."
That's it.
And then it's been miserable ever since.
I know, right? It's been awful.
Yeah, absolutely terrible. So, and it delivered absolutely everything that I didn't know I needed, and more besides.
So what would you say that you've gained from the program?
Privacy, candor, safe space, no judgment. People going through similar, or not similar, and we discussed recently the why, and for those that are watching, we have a particularly good little group of a Thursday evening, and we just we wondered why, and of course it was the fact that it was a lot easier for us to commit to a evening than it was early on a Monday morning in terms of how you were likely to feel. So we ended up with more, I suppose, on a medical intervention path of that. But even then, it was still interesting and in some ways quite surprising. I think how quickly we bonded. There
is a good sense of like camaraderie in the group. Can really feel that. Even though like you guys have never met before, you're in different parts of the country, and the only way that we've connected is via a Zoom meeting room.
Yep. Once a week, and then not even that reliably for most of us, because we've all missed weeks, and over a 12-week period. The benefit, the benefit of that has been immense, absolutely immense. Because you can.
So what's
for anybody watching that hasn't participated in one of our groups, it's a not a P's and Q's group. It's safe to say what you think, how you feel, and how angry you are with this disease, and we do tend to get it out there a bit, don't we?
Yeah,
which
well,
is
that's
also very good.
that's it, right? And that's what we're hoping to help you with through the program. It's not just about doing exercise, because for some of you guys, just even waking up in the day and just moving about the house is a challenge. But for you, like, what you're gaining is just that release, that understanding, and that just working through it on the mental side of it, and you get that community, and that's what.
Well, as you know, the I was concerned about how we could, how the program related to empirical data for the benefit of prostate cancer research. We've sort of established that there are some very effective ways of providing empirical data. Certainly for those on active surveillance that are doing the more of the fitness routines, changes in body shape, changes in body mass, weight, the dietary side of things. These are good solid empirical. But there again, for those of us on the more aggressive end of the disease and the treatment, I think it's still producing some good empirical data in terms of
the softer
what
side.
we're able, but also in terms of what we're able to do and what we're not able to do, and the way that is communicated. And there is I'm a firm believer that your outcome with any form of severe disease is one up here.
Yes.
So that really is the place that you have to start. But what I've become more outspoken, I suppose, about is the facts around the preconceptions about this illness, and the reason that's why it's been neglected, and why we don't have a screening program. Because most of us will have gone symptomatic before we get diagnosed. I mean, there will be, I'm sure, and there will be GP practices or other procedures, that where they will take a PSA test as a part of. But there's an awful lot of us out there that don't, because that's not what expected of GP surgeries.
No.
Nothing would have changed my outcome this year.
No.
But it could have done last year. And we represent an extremely common form of disease. And whilst we're not comparing apples and apples, as it were, women, and quite rightly so, women's health, for example, they've been brought up to expect and to participate in programs, whether it's cervical smear from the 20s or mammogram post-menopausal.
But would you say though that could also be a masculine thing, as well? Because from my history of working with men, they don't like to make a fuss. They just crack on with things, and then they'd rather deal with the problem when it happens instead of before.
Yeah.
And also, what we need to remember is that with the like you just said, the females, like, we can't compare men and women because different programs. But the smear, like we said, the smear starts when the women are 20.
Yeah.
In the 20s, but But potentially the male screening won't happen until 40s, maybe.
But that's fine. And I mean, you know,
But that's fine. But also,
how
it's
many of the
then
men?
by that point, men becoming more stubborn,
Well,
right?
we're not going to change, you know, the male attitude to health
No,
overnight.
we're not going to. No,
We're not. You know, they're not going to suddenly go down the pub and start talking about their urinary habits,
their prostate.
their prostate. You know, that's not going to happen. But likewise, you know, culturally and what have you, we're not going to go and insist and kick up a fuss in a GP surgery to get a finger up the bum.
No.
If there's no symptoms, or to insist on a blood test. It's just not. So, you know, whilst I was not comparing, although I was, but because it's ingrained, you know, in women from a much earlier age,
Yeah.
and the expectation of you have these things, whereas we never do. You know, maybe that'll change as coming through. I mean, I'm considered young. You know, you know, at 59. But how many of the people watching this, how many of the people that signed up to the program actually realize that the prostate starts growing at the age of 40? It starts changing. I didn't. You know, I had no reason to particularly think about that, other than the fact of when you see it and you go, oh, that makes sense then. That's why men have difficulty weeing. You know, it just does. So we have a piece of plumbing that only actually has a 40-year guarantee. Not even a lifetime warranty.
No, that's it.
And you know, and within that, it can do all sorts of things. So when we're comparing, you know, so I'm comparing. You know, you will have in a given year somewhere around about 3,500 cases of cervical cancer. You'll have 55,000 cases of breast cancer. Tucked in the middle of that, you've got 44,000 cases of prostate cancer, of which 15% will be like mine. And that's already worse than, in terms of numerically, cervical cancer, for which there is a long-standing screening program. And from an actuarial point of view, we are damned expensive. You know, by the fact that, you know, we usually have it before we get into the system. And then at the more extreme end, a lot of us are on treatment. And quite immediately, whether it's having it removed, whether it's having radiotherapy, the cost of investigation, doctor's times, health service times, MRIs, CT scans, X-rays, ultrasounds, you know, you take your pick. We're expensive. And I'm not going to tell you how much I paid into the system over my working career, but it's quite substantial. And I basically used that up in a quarter. When you run through the costs of cost of treatment and everything else.
Yeah. So we can see then. So we can then definitely see that it's there and it needs to be. Well, like we've said this before, it needs to be worked on, doesn't it? Like something needs to be done with regards to this. So,
yeah.
So yeah.
You know, I am now 59 years old. I am considered young. Whoopee-doo. This thing has actually just turned my life upside down blew it up, shredded it. Everything I was planning, everything I had planned, everything that I, gone in slow motion over a period of 8 months.
That's it. So how has the remove program, how has that benefited you during your time, Paul?
We've helped me keep my sanity, which is always a helpful thing. How has it benefited me? Because one of the key things it's done is provide a space where to talk. Where you can't talk to other people. So I said, that's what I said earlier on. It starts to make a liar out of you. Because you don't want to tell loved ones necessarily how you feel. You don't want it to define you. So, obviously for those watching, we've got the big hairy profile photo from a month ago, quite deliberately, because now I'm sitting here, having basically lost my hair through chemo. And that was a big thing for me. Not for a vanity thing, because we've done, not in the slightest. But I always looked well. So suddenly I've lost the ability to say to people, yeah, I feel fine. Because I'm not fine. You're walking around with a beanie on your head and no hair, when people have used to. And do they jump to conclusions? Yes, they do. And they jump to the correct ones. So then you find yourself explaining. And it's that lack of control. It's changed my ability to be client facing. Because I work around in male-dominated industries and what have you, but on projects and things that would, generally speaking, be anywhere between 18 months and 36 months. Oddly enough, the cancer patient sitting in front of them, despite the organisation around me, all the people around me, the cancer patient sitting in front of them, not good. It's not a good look. It's not a good sales pitch, because there's still a lot of stigma.
Yeah.
And false presumption. I don't know with incurable how long that means. I know it means I'm not going to live into old age. But there's quite a sliding scale in between that. And the remove program has been really helpful in discussing or the conversational aspects with the guys. We also do take the program seriously. I still try to do some exercise. It's like, leg pressing, yeah, but also I could do a half-hour plank. Now I'd actually struggle because of the damage to my bones to actually hold my body, and without pain. So, using the program to find different ways of approaching the same problem in a less painful, shall we say, a less difficult way of dealing with things. The understanding, redefining boundaries, getting help in understanding that actually this thing doesn't define me, and how we can help, how we can improve that fitness and diet so that I am actually as prepared as I can be for dealing with, these cycles.
Thrown at you. That's it.
Yeah, and it is, and it is tough. For the people watching and what have you, I am on the triplet therapy, which is sort of a roll of a dice one, which is oral and IV chemo, 2 different types of steroids, immune boosting injections, morphine. It's like, and that's before we start on all the things they give you to deal with the side effects of the things that they give you, for which you then get other things to deal with the side effects of the things that give you. Yeah, it becomes a full-time job.
That's it. Just monitoring that. That's it.
Yeah, and they want you to feed back into them. Remove has been incredibly helpful in terms of navigating that journey. So, I have to recommend it to anyone, at whatever stage they're at, and without wanting to be the doom merchant or anything else. Half of those on active surveillance will end up, not necessarily like me, but certainly requiring, medical intervention or additional treatments, at some point on their journey. And it's a shame. It's a shame in some regards that the remove will be a limited program in terms of time and what have you. But hopefully it can provide everybody with the base blocks, the building blocks of recognizing that small changes can actually make managing it easier. And then hopefully that feeds into prostate cancer research. Hopefully we get better research coming out of that. Hopefully for those of us on the incurable, we can stay ahead of the game long enough that the treatments and the drugs start to make it into what it should be, which is a chronic illness. And hopefully from that, we can, prostate cancer research can, as we have done with the petition and everything else, is bang on to get a screening.
That's it.
Because a lot of us watching this, a lot of us in the program will have had our poo box last year, bowel cancer screening, which delivers a very similar number of cases per annum as prostate cancer. Catch it early, it can be fine. Oh, yeah, what about prostate cancer?
Yeah.
Proven. Catch it early. It's fine.
That's it.
Catch it early. Catch it early, it can be a condition. It might become a chronic condition. But that's what it is.
Yeah.
It didn't need to be this, and that's obviously from a slightly selfish perspective.
Yeah, no, I get that. I totally get that.
It didn't need to be this.
No.
And why when we represent 50% of the population, why when we've got a government that's banging on about the loss of economic hours post-COVID, because a lot of men my age and what have you decided that we're not going back to work, and yet you're missing something that does actually have quite a significant impact on the male population. 1 in 8.
That's it.
And then, as we discussed in group as well, which again I didn't realise, that if you are of an ethnic background, statistically you are far more likely to develop it. And obviously, like most of these hormone ones, if there's a family history of it, so there's
lots of factors. There's lots of factors out there as well. So
Yeah, but then you realize actually that your chances of getting it are actually a lot higher than you think.
That's right.
Yeah.
Yeah. Sorry.
You know, and like everybody else, I didn't. It wasn't giving me any chips, so I didn't even think about it.
Exactly right. Exactly. So, what would you say to someone that's watching this video that they've seen the remove program, but they're like, I'm not sure if it's right for me because of, that's probably similar to you. What would you say to someone that's watching this, that's considering joining the program?
What, with my prognosis, or?
Yeah, your prognosis, but any prognosis, along the lines of with prostate cancer. What would you say to them?
Well, one, I would say do it. Yeah, no question.
That was very definite. I like that. I like a definite answer.
No question, because I went in cynical, and with my reservation.
Did you?
Yeah, I did.
Yeah.
And fortunately or unfortunately, I suppose, as I said, you guys were with me, on my journey. So we have discussed, about recommending or putting on two paths, as it were, between those, at my end, as opposed to those on the active surveillance, because the two things are quite different in terms of the outcomes and what people can give. But either way, regardless, do it. There is a lot that will be going on in your head. It makes it difficult to prioritize. It makes it difficult to focus. One of the things I found with the Zoom calls, or I find with the Zoom calls, is it's a date. It's in the diary. It's not a shaming thing. It's not that thing. But psychologically, it's something you want to participate in. And you look forward to it. And if you don't look forward to it, but you want to participate. So that helps start to put a little bit of structure back around things. Doesn't matter where you are on the spectrum. It's gives you a bit of structure in terms of I need to think about what I was eating. Adam's going to ask me what my win for the week was. I'm going to swear at him. The exercise, the structure that you have in the program, and the progression of the structure, is very, very well put together. Is very well put together, and people will find, people, I would hope, will find themselves falling down the path, as it were, of improvement, rather than feeling like they've been badgered into it. And then we have the subliminal thing, the one that most men would shy away from, be scared of, the lovely phrase, cognitive behavioral therapy. That's all a bit black magic. That's all a bit weird, all a bit hippie. It's not. Talking to people that are going through what you're going through. May not be that they're on the same treatment, may not be but they're still going through it. They still have to tell loved ones. They still have to think about their work. They still have to, how long am I out with this? What about the finances? What about the talking element is incredibly valuable. Should never be underestimated. As I say, we've been very fortunate with our group that they're going to ask you the following week, how have you been? How was your treatment? How was your, and that is quite important, because you can sit there and go, that really sucked. You can say things that you can't say at home. You can't say,
No, you can be honest. You can be honest. So yeah, nice.
Yeah. That is important.
No. Good. Well, we can see that you've really gained a lot. Even though you were very skeptical at the start, I can really see that you've gained a lot from the program. So I'm really, really pleased. Really, really pleased for you, Paul. Now, Paul, I'm sorry, but we're going to have to wrap this up now. So apologies for cutting this short, but thank you so much for taking the time out today.
No, absolute pleasure.
For joining us, okay? And, for anyone, like you said, that is interested in finding out more about prostate cancer, please, like Paul said, go and actually look at some proper reputable sites. So the first one is prostate-cancer-research.org.uk, where you can just see all the work that they're doing and the research that they're trying to gather, and also the work and the push that they're trying to get for the screening test as well. So you can really start to see that. But again, Paul, thank you so much for taking the time out today just to come and share your journey with us. It's been a very fast roller coaster.
Well, yeah, hopefully it wasn't all doom and gloom.
No.
But as the poster child for the dark side, actually people watching generally on this will be there for posterity and everything else. Prostate cancer is not a one size fits all.
It's not.
It does have a dark side.
Yeah.
And that's roughly 15% of those of us that will be diagnosed. And when it does, it's not pleasant.
No, that's it. But no, thank you, Paul, again, for taking time and being honest and sharing your story. So I really, really do appreciate that.
That is one of the advantages of Remove. You can actually feel honest. You can be honest.
Yeah.
You'll benefit from being honest.
Well, yeah, that's it.
Yeah.